Well, it's been identified as the single largest investment in healthcare infrastructure in the country.
And today, the country's leader, along with several cabinet ministers, toured the multi-million-dollar Critical Care Block at the Princess Margaret Hospital.
And while government officials were impressed, our Andrew Knowles tells us that there are a few concerns.
Officials say construction on the new Critical Care Block is 95% complete and within budget. Out of the $55 million budgeted for the project, about $51 million has been spent on the 66,000 square foot addition that expands 3 levels. The block will be outfitted with an additional $20 million in state-of-the-art medical equipment for 6 operating theaters, putting the Bahamas on the cutting edge.
And the one concern I had was whether or not, having spent all of this money, someone like Dr. Ernie Sands or Dwayne Sands would be able to perform complex heart surgical interventions here. I'm told that the physical premises are sufficiently accommodating to enable that to happen. Clearly, then it's a question of the right equipment. So for me, that was some kind of gratification to know that we have the right size here.
Prime Minister Perry Christie, along with several cabinet ministers, toured the project Monday afternoon. The new facility will consist of 18 recovery beds, 20 intensive care unit rooms, 48 neonatal intensive care beds, a new main entry, and new laboratory facilities. But Health Minister Dr. Perry Gomez still has some concerns over the amount of beds in the ICU.
20 beds in an ICU in today is less than twice as many that we had for the previous 50 years, and the population has quadrupled, and so the need for ICU beds is much more, and so we will probably still have the issue, but not to the same extent we had.
And with millions of dollars in equipment, the priority now for hospital officials is training.
We started a critical care training program, which is certified by the Royal College in the United Kingdom. And so training is ongoing for the critical care block. And so we're satisfied that nurses are being trained. In addition to nurses being trained, there are other categories of staff that are also being trained so that once we open, we have the staff that we need.
Now, construction officials will hand over the new state-of-the-art facilities to the government sometime in October. Shortly thereafter, it will be officially opened to the public. Andrew Knowles, ZNS Network News.